Hello everyone. This is Dr. Pawan Prasad, consultant surgical oncologist at Manipal Hospital, Jayanagar. Today, I would be discussing gastric cancer. November is considered Gastric Cancer Awareness Month. The idea behind awareness is to enable the public to detect the early signs of gastric cancer so that the treatment can be initiated at an earlier stage and impact in higher survival rates. Why do we have to detect gastric cancer early? The reason being, it's one of the most commonest cancers which we come across in our day-to-day practice, which presents at a very advanced stage. The only reason being, most of the symptoms in early stages are very subtle and often they are dismissed as something trivial like gastritis or indigestion. Remember, if you have any of these persistent symptoms, these mandate immediate medical attention. For example, persistent heartburn, persistent indigestion, pain in the upper part of the abdomen, predominantly above the navel area, difficulty in swallowing, unexplained weight loss, loss of appetite, and early satiety, that is, even small amounts of meal causing fullness of stomach, and passage of black tarry stools, unexplained anemia. These are the few symptoms of gastric cancer. So, what are the risk factors of gastric cancer? Again, we have modifiable and non-modifiable risk factors. Among the non-modifiable risk factors, we have genetic causes. If gastric cancers run in the family, there's a high chance that an individual can develop gastric cancer. Among the modifiable risk factors, we have lifestyle factors like diet. A person who consumes a lot of processed food, high refined sugars, and does not consume enough of fibers like raw fresh vegetables, he is more prone to develop gastric cancers. And also, chronic alcoholism and smoking can contribute to gastric cancers. And infections like H. pylori infection, which can cause chronic gastritis, can also lead to gastric cancers. These are the few risk factors of stomach cancer. How do we prevent gastric cancer? Prevention is always better than cure. One thing is always stick to a very healthy lifestyle. Avoid processed food and as much as possible, please abstain from alcohol and smoking and adopt a very active lifestyle. Exercise regularly and please refrain from all the junk food. So, these are the few steps which can prevent gastric cancers. Thank you.